we're much more of a high profile now. People will actually contact us, they know who we are, and they understand far better what we do.
I think the CQC's greatest achievement over the last 12 months externally has been increasing the public's perception of them and making it a positive experience for people. I think internally the greatest achievement has been keeping everybody within the CQC up to date with what's going on and the changes that we were going to be expecting.
We all now know that CQC's purpose is to make sure that health and social care services provide people with safe, effective, compassionate and high quality care, and we also encourage services to improve.
I think that the advancements we've made internally with how our people feel to work at CQC is the biggest win of all. So if you look at some of our latest survey data, for example, you'll see not only did participation increase, so my CQC colleagues actually want to talk about how they feel working at CQC and want their opinions to be heard, but also levels of engagement and general motivation at work have risen as well.
I think at last we have a culture through which CQC is clear that it's principally here to protect people and to improve services. I think that perhaps in the past we haven't always had that clarity, and as a result staff haven't always been confident in delivering some of the harder parts of their work, especially in refusal, where we're sometimes refusing applications from quite big companies and in any case from individuals who are going to challenge us if we don't produce the registration certificate they've applied for. So I think if staff are going to do that refusal work, they need to feel confident that the culture of the organisation supports them.
I think my greatest achievement over the last 12 months has probably been around developing a tailored questionnaire for people, for carers, for local groups concerning the work we're doing around mental health crisis care.
My greatest achievement over the last 12 months was identifying a provider that thought that they were giving really good care to people that were using their service. And during my inspection I found that they actually weren't, and that actually hurt them, and they were really upset because they really thought that they were achieving good standards of care. So for me it was really good to identify that and allow them to make changes in how they were treating the people that they were serving.
When I was a call handler within the NCSC, I remember taking a call from a whistleblower who wanted to raise some concerns about the service in which they worked. They were very reluctant to share any information because they were quite concerned that their identity would be shared. For me, it was a case of reassuring that individual, taking time to really listen to what they had to say, which then enabled me to get all the information that we required to pass on to an inspector to ensure that those concerns were investigated.
The rating system in terms of rating services actually helps providers to actually turn around and say, I want to be better, rather than what we were looking at, which is whether they meet a regulation or whether they don't. And I think it's important that we actually try and improve healthcare rather than just trying to look at that bottom level of are they compliant, are they not compliant. And I think these new changes will actually bring about a whole sea change in terms of health and social care generally.
The work it's doing around mental health is really interesting, really innovative, and not many other people in the field are doing similar pieces of work. If we can really push that up the agenda, I think that the CQC can make itself a leader in the field and also really make a difference to people's lives. But the challenges are there for all to see, and we're coming up to a general election next May, and the whole landscape may change again, and we have to be ready for that.
It's very demanding, but it's very rewarding as well, being able to help people in healthcare and being able to make sure that they're safeguarded against abuse or neglect. And I think one of the things that needs to be put across is that we're always changing, we're always trying to increase our understanding of how the system works and how we can maintain that system. And it will be tough, and we're not perfect, we're not omnipresent, but it is very important that the public can give us lots of information so that we know what's going on out there in the real world, and so we can change our processes to make sure that they're as safe as they can possibly be.
Working for CQC is always a challenge. No matter how experienced you are, the work always throws up new challenges, new issues that perhaps either you haven't come across before, or that you have come across before but that haven't necessarily been handled in the way that you should. So I think it's always challenging. It's one of the reasons why I enjoy it so much. But I think in order to handle those challenges, we do need to have a culture that enables people to use their judgment, values the input they make, and then doesn't seek to blame people if perhaps some of the risks that involves don't go in the direction that necessarily we want them to. You know, we improve something in the registration process, and that means the website needs to be changed, that means the IT system needs to be changed, guidance needs to be written, policy might need to change. And often, in an organisation as big as CQC, that can take time. And the risk is that people become frustrated and that the change gets watered down and doesn't happen. So I think for me, what I hope about the next 12 months is that CQC retains its determination to improve and that we don't compromise on that, you know, when it becomes difficult to deliver those changes. We hold fast to that commitment that we've made to make sure that what we do in registration and inspection and our enforcement activity does actually improve and to deliver those changes.
To be honest, it's a tough environment at the moment. We are very short-staffed. We are delivering a program of activity with half the number of inspectors that we should have. However, staff have been pulling together to ensure that the organisation delivers its business goals.
We're doing some really great work, and I think people are beginning to see the work we're doing and the importance of it, but we can't kid ourselves. There's a lot of work to do and the challenges are only going to get greater.
I think the future for the CQC in the next 12 months is very exciting. I think that we have a real chance to improve our public perception, get the public understanding what we do for them, and get their stories, not just the negative sides, but also the good sides as well, and then be consistent in our approach, and then providers will know what they've got to do in order to improve on the quality of care that they're giving.